Welcome to the Time of Your Life with the Baltimore County Department of Aging. I'm your host, Ethel Rasmussen. As always, the Time of Your Life is about sharing resources for living your best life and dedicated to keeping you well informed about the programs and services that are especially designed for you. You can also connect with BCDA through our agency's multiple media platforms that include our website, Facebook, the Time of Your Life Digest, Flickr, and Map, as well as abundance of printed resources. Connections to BCDA are stronger than ever, so please take advantage of the many options we offer. Today's show offers empowering information along with the option to enjoy additional opportunities to make a difference in your community during the holidays. Allison Vogren, Volunteer Center Manager for Baltimore County, shares information about the center. Stay tuned to learn about ways to connect with organizations in Baltimore County that need volunteers. We begin today's shows with a popular and important topic, especially during this time of year. Yes, you've guessed it, Medicare Part D open enrollment and benefits. Let's start the show with Shelby Jones of the State Health Insurance Assistance Program of Baltimore County, known as SHIP. Shelby, thank you for being on the show today.
Thanks so much for having me, Ethel. I am so happy to be here and to talk about all things Medicare.
Prior to starting our conversation about Medicare Part D, can you briefly share the responsibilities of BCDA's SHIP office?
Basically, we can help you if you are someone who is what I like to call a seasoned veteran of the Medicare program, who maybe needs help during this open enrollment time frame that I'm sure you've heard an awful lot about. Or maybe you're someone who's brand new to the program. Maybe you've just turned 65 or you're about to turn 65 and you've started getting things in the mail. We are here to help through any piece of the process. Wherever you may be in the Medicare world, we are more than happy to assist. And again, I cannot say it enough, our team of volunteers is absolutely incredible.
Shelby, you are so right. SHIP does provide an invaluable service to Medicare beneficiaries. Let's begin by talking about Medicare eligibility and enrollment. What are the basics our viewers should be aware of?
I will talk first as if someone is coming in at the age of 65. That is what is most commonly known as aging into the Medicare program. So you have 7 months to sign up for Medicare. That's a long time, but we all know how time can certainly fly. So you have 3 months before you turn 65, the month of your 65th birthday, as well as the 3 months after to enroll in Medicare A, B, and D, which is specific to prescription drugs. But don't worry, I'll get into the ins and outs a little bit later. Now, someone can also be eligible for Medicare if they are under the age of 65, if you've been receiving Social Security disability benefits for 24 months. You become eligible for Medicare at the 25th month. You can also have some other qualifying events, such as having Lou Gehrig's disease or being diagnosed with end-stage renal disease, ESRD. Those are some other qualifying events where someone can be eligible for the Medicare program as well.
So you mentioned the ABCs, or the different parts of Medicare. Can you give information about each benefit and what that benefit covers?
Absolutely. So Part A is everything that's inpatient. So think inpatient hospital stays, skilled rehab stays, hospice. Part B is everything outpatient. So doctor's offices, x-rays, labs, and even some medications. So I will share with you something that's very interesting is that if you are on a medication that is utilized in a piece of durable medical equipment, a prime example would be maybe you're getting a solution that's used in a nebulizer. That solution is actually covered under your Part B benefit. Surprise! Now, Part D, I know I'm skipping ahead a letter. Don't worry, we'll come back to Part C. But Part D is your prescription drug benefit. And that's what all the hubbub is about right now during open enrollment, which is running from October 15th through December 7th. Now let's backtrack to Part C. Part C is Medicare Advantage. So Medicare Advantage actually acts as a substitute to original Medicare. So while you still have to be enrolled in Medicare A and B, and yes, that means you have to pay that Part B premium, you would actually utilize your Medicare Advantage plan card at the time of service. So if you're going to the doctor, if you're going to the hospital, or if you're going to the pharmacy, you would use your Medicare Advantage card if that's the type of plan that you have at that time of service. I hope that helps clear some things up.
Definitely. So there are ads on TV mentioning a Medicare Advantage programs that have give back programs that allude to Advantage plans with no copay. Can you address these topics?
Absolutely. So I want to start by saying sometimes Medicare Advantage plans get a bad rap, but really Medicare Advantage plans are a great way to receive services all from the same plan. And it's very similar to the way that commercial insurance works in the working world. You may need referrals if you have an employee health plan. There are things that people have become accustomed to from different health plans that are available not only on the open market, but also through employers. So that's really where the Medicare Advantage plan came to be. Now, there are plans that are advertised, as you said, Ethel, where they're advertising things like no premiums, no copays, and boy, does that sound great. These plans are out there, but they are not available to everybody. Not everybody is going to be eligible to receive those Advantage plans. The Advantage plans that you're describing that may have flex cards, that may pay utilities, that may offer help with grocery bills and things like that. Those plans are specific to folks who have both Medicare and Medicaid, or Medicare and QMB, which is one of the Medicare savings programs. And it's designated to be very similar to the Medicaid program. So again, you may see those commercials on TV, and I know they sound so enticing, but if you want to check your eligibility, you can certainly call the SHIP office, and we'd be more than happy to see if you are, in fact, eligible to receive those benefits through an Advantage plan. I know it gets a little confusing.
Excellent. Shelby, we're going to take a short break, but first, please consider subscribing to BCDA's newspaper, The Time of Your Life Digest, now in its 45th year. The Digest is a newspaper filled with news, the latest government happenings, columns and articles from the county executive, county council, and other Baltimore County agencies. You'll learn about Medicare, nutrition, recipes, health-related subjects, travel, senior center programs and events, volunteer opportunities, and so much more. Subscription rates for a Baltimore County resident is $5 annually. For more information about the Time of Your Life Digest, please visit the newspaper's website or call 410-887-3050. If you're a business owner, this is your opportunity to outreach to a target audience. When we return, learn more about Medicare Part D.
An official message from Medicare.
Let's give her a minute before we start. You know how she is.
Y'all check your Medicare plans? It's open enrollment.
No, why?
Because plans change each year. So can your health. Make sure you choose the right plan for you and your budget. You might save some money or get a few extras.
What I missed?
Open enrollment ends December 7th. Compare your prescription drug and health options at Medicare.gov. Paid for by the U.S. Department of Health and Human Services.
Welcome back to The Time of Your Life. I'm your host, Ethel Rasmussen. Let's continue our conversation about Medicare Part D with Shelby Jones, who works within our Baltimore County State Health Insurance Assistance Program known as SHIP. Shelby, for Medicare Part D, the prescription drug benefit has a designated open enrollment period from October 15th to December 7th. Can you talk about the importance of these dates?
Absolutely. I cannot say enough about the importance of these dates. So during this time period, the SHIP office has a team of volunteers, both some of our year-round counselors as well as designated Part D volunteers, who are out at different senior centers all throughout this enrollment period of time. And what we do is we're sitting down working with folks to make sure they understand, hey, is the plan that you're currently on really going to be the best plan for you financially in the new year?
So what type of assistance is available to support Medicare beneficiaries with their research?
So you can reach us at 410-887-2059. Now, I like to preface and let everybody know up front, Please, due to the high call volume, leave us a voicemail and we will return your call in the order in which it was received. We are so happy to set up appointments both over the phone if you're not able to get to a center or at your local Baltimore County Senior Center, and we're happy to see you there. You can also do the research yourself. I will tell you, I know we might seem like miracle workers, but we're really utilizing the Medicare.gov website. It's called the Medicare Plan Finder. You can type this into Google or again, just visit medicare.gov. It is very, very easy to walk through this process. And quite honestly, it's very user friendly. You do have to enter some information like your zip code, like your medications, and if you set up an account for yourself, or we are more than happy to do that on your behalf, it helps the process to go even quicker year after year to have that username and password, those login credentials. So that way you can bring up your medications, see if they've changed, and take a peek and see, hey, maybe the pharmacy that's right around the corner that I've been using for 50 years is a wonderful pharmacy and I love the pharmacist, but if I go 2 miles to the left, maybe I can get a better deal. So we can definitely shop pharmacies, shop plans, and we can also go over different information related to Medicare savings programs and ways that you can save on your prescriptions as well.
Excellent. Please review with our viewers the information they need to know about the 2025 Part D changes.
Absolutely. So nothing can be made easy, right? There's always things that are going to be changing, but change is good and change is healthy. So I always like to remind people that change might be scary, but change is not bad. So let's talk about some changes that are happening in 2025 for the prescription drug benefit. The first is that there is going to be a $2,000 out of pocket cap on prescription drugs. What does that mean for you? It means you will not be spending more than $2,000 out of pocket over the course of a year, in theory, for your covered prescription drugs. If a specific prescription drug that you are taking is not covered under your plan, that will not count towards the $2,000 cap. And also, the amount that you pay per month for your premium, just to keep that insurance active, is not included in that $2,000 amount. We've had some questions about that already, so I just like making sure that everybody knows all that information. Now, the other piece that's going along with that is the dreaded donut hole. What the donut hole was, or the coverage gap was a period of time where you reached a certain amount in drug costs, and at that point, you had to pay 25% of retail for brand and generic drugs. Well, 25% of retail for generic drugs probably wasn't that much out of pocket, but for a brand name drug, it could make your costs skyrocket. So that will no longer be happening in the new year, which is very exciting. Now, you may be thinking, well, what if I am one of the folks who takes a number of brand name drugs, or maybe just one, and I know I'm going to hit that $2,000 cap pretty soon after the first of the year? Well, what are my options? Thankfully, there is a change to the Medicare prescription drug program that I can share with you that's happening next year. It's the start of what's called the Medicare Prescription Payment Plan. So, the Medicare prescription payment plan is basically balancing your prescription budget. So, if you know you are going to hit that $2,000 cap at the start of the year, maybe January, February, or March, you can say, okay, I'm going to talk to my prescription drug plan about setting up the Medicare prescription payment plan to balance out that $2,000 over the course of a year. It may help to just make that amount that you're paying more palatable, which is a good thing. So again, the Medicare prescription payment plan is not something that you would set up through 1-800-Medicare. It is something you would set up through your prescription drug plan, whoever that may be in 2025. So if you have questions about that, definitely talk to your drug plan and see if that may help you. We, as Medicare counselors in the SHIP office, are also able to get a sneak peek of how the Medicare prescription payment plan may also help you in the new year. So again, we can share with you just for informational purposes if it may be of interest, but we can't actually sign anybody up for the Medicare prescription payment plan. So there are some really new and exciting things happening in 2025 related to the prescription drug benefit under Medicare.
Change is good. You were right.
Changes.
Let's talk about some information about extra help for those beneficiaries that qualify.
Absolutely. So, Extra Help is a federal program and it's actually run through the Social Security Administration. And it's meant for folks who have a lower level of income and assets who may need assistance with their prescription drugs. As we all know, prescription drugs can definitely be expensive. So, it helps to keep your prescription drug costs very low. I'm going to give round numbers here. So, for a brand name drug, I don't believe you would be paying more than $5 for a 30-day supply, and I believe it's around $3 for a generic, but it may even be less than that. Now, they do look at income and asset criteria for that. What is an asset? An asset are things like stocks, bonds, IRAs, savings accounts. They're also going to look at real estate property that you may have. But remember, your home that you own will not count against you. One car that you own will not count against you. If you have multiple homes and multiple cars, that's going to count against you. So, if anyone has questions about whether or not they may be eligible for extra help, please call the SHIP office. Again, our number is 410-887-2059 and leave us a voicemail. We'd be more than happy to have one of our counselors reach back out to you just to see if you are in fact eligible. And we are actually able to complete that application online on your behalf with you on the phone. So we can get that process moving with Social Security, which is very exciting. We're also able to do those applications for you in the event we determine that you are eligible for the Extra Help program if you're at an in-person appointment with us as well. The wonders of modern technology. I love it.
Excellent. In closing, any final thoughts that you would like to share with our viewers?
If I could pick one more closing thought, it's so hard with all that we've talked about today, Ethel, but it really is just stressing the importance of taking the time to review all of your prescriptions, the pharmacies that you use, and really taking the time to see, is the current plan that I'm on going to be the best for me in the new year? We hear all the time, oh, but I like my plan. You may like your plan, but is your plan going to like you, right? As we've discussed, change is good, change happens. So we just want to make sure that we're stressing the importance of being prepared. I had a professor in college that always used the quote, failing to plan is planning to fail. No one wants to plan to fail. So please call the SHIP office, 410-887-2059. Leave us a voicemail, set up an appointment with us. Again, we're doing phone appointments for Part D as well as in-person appointments at various senior centers across the county. We are more than happy to help you.
Shelby, thank you for sharing information about Medicare and how Baltimore County will support beneficiaries.
Thank you. Happy to be here.
We're going to take a short break, but first I'd like to share exciting news about our caregiver conference happening on November the 14th. Please call 410-887-4724 to register or just to learn more. When we return, we will learn about the Baltimore County Volunteer Center.